The last 1 week, we've seen the biggest surge in COVID cases in the last 24 hours. Look at the graph on your screens. At about 339 cases, when it started off on December 16th, alarm bells did ring off within the administration and they started putting out advisories, taking steps to ensure that there was no further spread. It went down briefly, but it's gone right back up. It's at 640 cases, and that's the number of cases that's been reported in the last 24 hours. Let me again reiterate for you that the reason you would also see numbers going up is because testing now is being ramped up in several states where the JN1 variant has been identified. Now, as far as deaths are concerned, no new deaths have been reported in the last 24 hours. 6 deaths essentially in the last 1 week that's been reported. And in all of these cases, as the government has confirmed, they were patients with comorbidities as well. So it wasn't solely due to COVID, as the JN1 variant, importantly, we must highlight here, is not one that triggers serious illness. Now, of the 640 cases that have been reported in the last 24 hours, the maximum number is again from the state of Kerala. And I want to bring in on this broadcast my colleague Shibi as well as Sagar Raja on this broadcast to tell you what's really the situation in these states. Let's focus first, in fact, on Karnataka. And let's tell you about the numbers that have come in, because the active cases in Karnataka stand at 105. 2 deaths have been reported in the state. And largely, the number of cases being reported is from the city of Bengaluru. That's again because testing is more in the urban areas than really in the rural pockets. Let's get you some of the reactions coming in from Bengaluru on what officials are doing to tackle this rise in cases.
We are at KC General Government Hospital in Bengaluru, and this is one of those famous and well-known government hospital. As of now, there are close to 20 beds which has been allotted for COVID patients in the OPD. Apart from this, you also have 2 ICUs, and each of them have close to 50 beds. According to the doctor and the superintendent of the hospital, Mohan Kumar, who claims that they are well equipped with oxygen, medicine and other requirements for the COVID patients. As of yesterday, according to the government report, close to 105 people have been reported that they have been infected with COVID. 85 of them have been advised for home isolation.
All right, let me take this across to Sagar Raj. Sagar, we just played out the report that you showed us of how hospitals are all geared up in case there's a rise in COVID cases. Holidays, of course, have kicked off. It's a long weekend. A lot of people have made their travel plans. Is that something that the government is keeping in mind when putting out fresh advisories?
As of now, there are no fresh advisories. What we'll get to learn from the health department is the technical advisory committee will advise the health department whether they have to go ahead and impose any kind of restriction. But as of now, there are no restrictions in the state of Karnataka. Anybody can travel anywhere. But they have advised people who are above 60 years and people who are in large gathering to maintain social distance and try to wear a mask in all these places. Okay. As of now, the government have clearly said that do not panic, do not worry. The situation is under control, and the hospital, you just watched my report, even in that particular hospital when I visited, there were not even a single patient in that COVID block. And in fact, most of them are at home isolation, whoever have been reported COVID positive, and whoever have comorbidities, only they are at hospital and under treatment. As we speak now, that is the latest news that we are getting from Dakshin Kannada is that one more person have succumbed due to COVID. He is 40 years old. He is from North India. He was working and he also had a diabetic and alcoholic, and the doctors have to confirm whether he has died due to COVID or comorbidities. As of now, he was also a COVID patient. He was under treatment at the hospital, but he is no more.
It's important to highlight that these deaths, as Sagai also told us, is of patients with comorbidities. So it's not solely due to COVID that they're facing this kind of a critical situation. Let's focus now on the state of Kerala. If all the active cases in India, if you look at those numbers, a maximum of them are being reported from the state of Kerala. Even in the last 24 hours, maximum of them from Kerala. The active cases are 2,606, 3 deaths that have been reported in the state. Remember that the JN1 variant was first detected in Kerala, and this is something that the government has highlighted. There is, of course, a COVID task force that's been put in place, but they've also said that a lot of the people who are traveling into the state are testing positive for COVID, which is what is leading to this huge spike in numbers in the state. Let's get your reactions coming in from the Kerala Health Minister and other officials before I take this across to Shibi.
There is nothing to worry about because from November 1st onwards, we have found a slight increase in the number of COVID cases. So we had a rapid response team state level meeting and a ministerial level meeting was held, and in my meeting we decided to start genomic sequencing. We have been sending samples from November 1st onwards. So we are doing tests. There is no increase in ICU occupancy, ventilator occupancy or isolation bed occupancy.
Health Minister saying that every step needed is being taken right now. There's absolutely no reason to panic. And remember that there's no sort of rules that have been put in place with regards to mandatory masks or any of that at this point. Let me bring in Shibi on this broadcast. Shibi, this kind of an unprecedented spike that we're seeing in COVID cases in the state of Kerala, as much as the government says there's no reason to panic, will obviously trigger a lot of concern and worry. Explain to us what's led to this spike. Is it that there are a lot of people coming in from abroad who are testing positive? Is it that testing perhaps has been ramped up in Kerala more than other states?
Well, Akshita, the most important point, taken out by Health Minister Veena George is that the number of tests carried out in Kerala is very high in comparison to other states. She said she had attended a meeting with all the health ministers from various states, and when they were presenting the data, she was saying that the number of tests done here is really, really high in comparison to other states. And she said that the situation is we heard her speak, she's saying that the situation is very much under control. There's no restriction in place. And she said that out of all the people tested positive, the active cases, only 98% of them are in home isolation. But of course, like you said, Kerala has a population that's spread across the world. The airports are one of the hot spots in Kerala because people keep coming from different places. Kerala's population, like I was mentioning, is settled in different parts. So it's also festive season, it's Christmas season. She was also saying that the Christmas tourism season has also been drastically affected because of the increase in COVID numbers. She said that since November 1st, they have been seeing this increase in COVID cases, and the samples have been sent for genomic sequencing.
Okay.
And also she says that the JN1 variant that was detected in a woman in Kerala was on November 18th, actually last month, and she's recovered fully. She said the transmissibility of this variant is very high, but the severity is less. So there's nothing much to worry. But yes, older people need to be a little more careful, especially with comorbidities. And she said all the deaths that have been reported are not due to COVID complications, but due to comorbidity, because most of them
that's important to highlight, and that's something authorities in every state really are mentioning, saying that this variant is not known to be deadly. Sagai, Shibi, thanks very much for joining us with those details. With holiday season, obviously tourist footfall in many states is also increasing, the likes of Goa as well. So I just wanted to also put out the data on what Goa and what the COVID cases in Goa looks like. Active cases in Goa is at 16 right now. And remember, many states right now aren't putting out data on a daily basis like they used to. The union government is putting out a lot more information. But if you've got plans to head to Goa for the holiday season in the next 1 week, should you be worried? Should you cancel your plans? Well, the Goa government hasn't issued any sort of advisory, but we thought we'll get you an expert on the show to explain what do you do in the face of this kind of a rise in COVID cases and with a new variant coming up. Joining us on this broadcast is Dr. Naresh Trehan, Chairman and Managing Director of Medanta, the best possible voice to explain all that we're seeing right now with regards to these COVID cases going up. Dr. Trehan, good evening. Thank you for joining us here on India Today. First of all, Dr. Trehan, I know a lot of people watching this broadcast are wondering, should we cancel our holiday plans? Should we stay put? Should we go back to ensuring that we don't mingle with large crowds? What would you advise, sir?
So the situation is like this. We know that the JN1 is present in our country, and there are some states that are showing higher rates of infection than others. But in the south mainly, Karnataka, Kerala and Goa are actually seeing a rising number of cases. So the alert that we want to give out to people today is, one, it is a very mild infection if it happens, except for those people who are already having comorbidities,
Yeah.
because they are the ones who are very vulnerable. So the advisory to them today is avoid crowded places. I don't think that there is enough alarm to say stop traveling. But
Okay.
if you're going in a plane or a train or in a bus, wear a mask. We all know how to wear a mask and got used to it 2, 3 years ago. And that's what you need to come back to, just to protect yourself, especially the ones with diabetics, elderly people,
Okay.
patients with people who already know they have heart disease and lung disease. These are the four vulnerable things that you normally are experiencing in large numbers. So actually, you need to protect yourself. No matter what advisory comes, whether to wear mask or not mask, it does not mean as an individual you need to protect yourself. The rest of
Okay.
the people, as we know, the transmissibility, because it's airborne, is very high, but the severity of the disease is not that high. So people do get flu-like symptoms, cough,
Okay.
cold, fever, but it usually passes within 2 to 3 days. So that's the current scenario that we know. Now, if you look at Medanta, we have seen some patients who are coming with lung infections, and there is one case we know which was severe, but the rest is not so. So everybody is testing again and again, but not everybody who gets a cold and cough should go and get tested for COVID, because just the fact that if you do have a cough and cold, protect your family and your environment by wearing a mask. So I think that's the current status that we have. Now,
Okay.
of course, we have to keep watching it on a daily basis, but there is reason to be alert, not panic, but alert for yourself and protect yourself if you are already predisposed.
Dr. Trehan, a lot of people also are rather dismissive about these cases going up. There are some who are saying that, look, this is cyclical, that every time during winter you see a slight rise in COVID cases. Do you think that's what this is?
It could be, but you know why second guess something which can affect you adversely if you are vulnerable? All we are saying today, the warning has to go to the vulnerable people, and you're not saying stay home or don't avoid crowds if you can, but wear a mask if you are traveling. You're in a crowd. Wear a mask, and N95 will protect you. So I think from that point of view, in a general view, for people who have had problems, should not expose themselves unnecessarily, because then you regret it later. And it is true that lots of people are having cough and colds that are not COVID. So that's why I'm saying that I don't think we feel the need for people to go get themselves tested every
Yeah.
time you get cough and cold. But at the same time, for the elderly, you must protect them. Even if you're at home, you're getting cough and cold, somebody has, isolate yourself a little bit or wear a mask when you are exposed to other people. There's no reason to, even a common cold spreads by airborne
True.
communication. So that's why it is important that if you know you're getting something, protect yourself and protect your environment, your people, your elderly, especially your elderly.
This particular variant, Dr. Trehan, if you could just explain to us, what are the symptoms that people need to really watch out for? I know there's a lot of talk about ramping up testing, etc., but people obviously are a little wary of going in for a COVID test right now, seeing as, they want that messaging of the pandemic is behind us, etc. But what are the symptoms to watch out for? Can this turn severe?
So far, like this is the season where people get flu. People get a cold and cough and fever. They do. But we don't know whether it is JN1 that is causing all this. No, we don't see it yet, because lots of testing that we have done is not very highly positive, because very, very few cases may have tested. Now, if you are like, if there are several states reporting that people who have returned, traveled to Nepal and come back, they're ones who are testing positive. Well, that's one thing, that you be careful about people who have been traveling overseas or areas from which there are rising cases. Then you just be careful, or isolate yourself or keep your distance. So I think that there are very practical ways of trying to protect yourself, which I have repeated again and again.
Yeah.
And I think that's what you need to do. Then to do really, there's no reason for panic, but there is definitely reason to be alert and protective of yourself.
Okay. Thank you very much, Dr. Trehan, for joining us here in India today. What you've shared with us has been extremely informative as well, and very useful, I'm sure, for many of our viewers who've been wondering if they should call off their holiday plans. Dr. Trehan telling you there's no need to do that, but also says there's no harm in masking up. It's the best way to ensure that you're taking care of yourself and those around you, even from a flu, not just from COVID. Thank you very much, Dr. Trehan.
Okay, thank you.